Hello, how are you doing, guys? With you, Dr. Hamid, an ECV certified physician. We've got today another high-yield case for the microbiology for the USMLE Step 1 exam. So this is a 32-year-old man with advanced HIV presenting with several weeks of non-bloody diarrhea and weight loss. He is afebrile and shows no abdominal tenderness. Biopsy of the intestinal mucosa reveals organisms lining the brush border and an inflammatory infiltrate. And the question asks is, what is the most likely cause of the patient's symptoms? So pause the video and think about the correct choice. And the correct choice is A, which is Cryptosporidium parvum. So this case, it is different from the case that we talked about in another video, which is Clostridium difficile infection. So although both cause watery diarrhea, the Clostridium difficile infection causes acute watery diarrhea versus the Cryptosporidium parvum that causes chronic watery diarrhea. So if we look at this vignette, this patient having HIV presenting with several weeks of non-bloody diarrhea and weight loss. So it's typical for Cryptosporidium parvum. It occurs in the people having HIV who are below specific CD4 count, typically less than 100. So it occurs in the people with HIV again with a CD4 count less than 100, and it has like watery diarrhea, it has weight loss, it can progress to cause severe watery diarrhea up to many liters per day, and it may be fatal. And it is diagnosed through either BCR first tool or acid-fast microscopy first tool. So either BCR first tool or acid-fast microscopy first tool. This is a way to diagnose it. And here the patient is afebrile, showing no abdominal tenderness. And if we look at the histopathology, it has like peculiar histopathology. The trophozoites line the intestinal mucosa, plus there is an inflammation of the lamina propria. So it has both some organisms lining the intestinal mucosa plus inflammation of the lamina propria as seen here in the vignette. This is very specific for Clostridium parvum. And the cytomegalovirus is a wrong choice. It has bloody diarrhea, unlike the watery diarrhea here in the vignette. Also, at the level of the histopathology, it is different. It has like intranucleic, intracytoplasmic inclusions, unlike the intestinal mucosa or lining organisms and inflammatory infiltrate in the lamina propria, characteristic from Clostridium parvum. And the third choice, which is Entamoeba histolytica, also it is different. It also has a bloody diarrhea, the same as cytomegalovirus infection, and also it has characteristic histopathological picture which has flask-shaped ulcer, and the population are also typically a traveler to a third world country coming back after his travel. And the Giardia lambelia also a wrong choice. Also, it has non-bloody diarrhea, but the diarrhea is pretty characteristic. It's usually foul smelling due to fat malabsorption. It has fatty malabsorption. It has foul smelling diarrhea. It may include some weight loss. Or again, it is non-bloody diarrhea, and versus bloody diarrhea here in the vignette. And for the Mycobacterium avium complex, it causes like it is very different from here. Also, it has non-bloody diarrhea and watery diarrhea. The histopathology is different. The organism is intracellular, so you will find constellation of acid-fast organisms inside macrophages. So it travels into the reticular endothelial system, and you will diagnose it by finding Mycobacterium avium complex inside of macrophages. So this is a way to be characteristic. This is a characteristic of Mycobacterium avium complex. I hope you guys enjoyed our video today, and see you in next videos. Thank you.